Hello, everybody. I wanted to take some time to talk about PTSD, which is short for post traumatic stress disorder. Let's get right into it. So, what is PTSD? Post traumatic stress disorder is a disorder that starts when a person experiences or witnesses an event that is dangerous, terrifying, scary, or shocking. The events are traumatic and usually involve a moment where a person's life has been threatened or when a severe injury has happened. So, PTSD does not discriminate and can affect almost anyone. We often hear about it associated with our veterans. However, you'd be surprised to know that almost anybody can be affected by the disorder. According to research by the National Center for PTSD, about 60% of men and about 50% of women experience at least one trauma in their lives. Some people can recover within a few months thanks to our body's fight or flight response. However, others may take longer to recover from trauma. It can take up to years, and it can also start years after an event has occurred. What are some of the causes of PTSD? Witnessing or experiencing something traumatic, and that is firsthand or secondhand, can cause PTSD. Some main causes of PTSD are war and combat, car accidents, experiencing physical and sexual abuse, and other natural disasters. Other causes can include, but are not limited to, bullying, being held hostage, terrorism, witnessing death, childhood trauma, and lack of social support. Let's talk about some of the signs and symptoms of PTSD. As I previously stated, PTSD can show up right away, or the symptoms can appear months or years after the traumatic event has occurred. There can be so many different symptoms. They range from emotional to behavioral to psychological. Some of the symptoms include agitation or irritability, self-destructive behavior like alcoholism or drug abuse. You can lose pleasure in some things that used to interest you. You can find yourself emotionally or physically detaching from those who you're used to being around. It could cause some sleep issues. You can have nightmares or insomnia. You may be hypervigilant, or you can start to be easily frightened by things that trigger something that happened in that traumatic event. You may deal with trouble concentrating or other symptoms like depression and anxiety. So someone has been diagnosed with PTSD. Now what? Let's get into some of the treatments. The American Psychological Association, or APA, strongly recommend 4 different interventions for treating post-traumatic stress disorder patients and conditionally recommend an additional 4 treatments. They all include a variation of cognitive behavioral therapy targeting the individual's personalized needs. Cognitive behavior therapy, or CBT, is used to focus on the patient's relationships with thoughts, feelings, and behaviors. It deals with the current symptoms and changing negative behaviors and patterns. Cognitive processing therapy helps patients to deal with unhelpful beliefs. Prolonged exposure. This is a type of CBT that shows patients to deal with their traumas head on by facing the things, people, and situations that they may avoid due to the trauma related memory. Brief eclectic desensitization is a combination of cognitive behavioral therapy and psychodynamic therapy approach. It deals with feelings of guilt and shame. Others include eye movement desensitization and reprocessing therapy, better known as EMDR, and narrative exposure therapy. Medications can be used with these therapies and are usually selective serotonin reuptake inhibitors like sertraline, better known as Zoloft, or fluoxetine, Prozac. Other antidepressants like Effixor can also be prescribed. Excuse me. Before closing, I wanted to go over some facts about post-traumatic stress disorder. While most people will experience a traumatic event in their lives, most of those people will not be diagnosed with PTSD. In order to be diagnosed with PTSD, you have to meet a certain criteria. During your evaluation, a number of things will be assessed, such as the time of your exposure, the type of symptoms you're experiencing, the duration of symptoms, and whether or not it affects your livelihood. Women are more likely to be diagnosed with PTSD than men because of the type of trauma they endure. For instance, sexual abuse. Veterans are more likely to develop PTSD than civilians. With that being said, veterans who deploy to war are more likely to develop the disorder than those who do not deploy. If you or a loved one are in a mental health crisis or having thoughts of suicide, don't hesitate to call 988 or visit one of the sites listed. It is very important to reduce the mental health stigma. PTSD is a disorder that can affect your mental health and can be associated with many other mental health illnesses. Some of the things we can do to reduce the mental health stigma: educate ourselves. Make sure that we're knowing the facts. Do fact checking. Look for resources. Talk about it. Don't be afraid to talk about your mental challenges, and don't be afraid or open to listen to other people's mental health challenges. Be aware of your attitude when dealing with people who are dealing with mental health crises. Be kind. Use kind words. And most importantly, focus on the positive. Support people around you and learn how to include everyone. Thanks so much for watching.